Hello and welcome to our PCC4U Educator Webinar. We're really pleased that you could join us today, and thank you for taking time out of your busy day to be here and chatting to us. So it's lovely to have you. We are hosting today's webinar from QUT in Brisbane, or Meanjin, which is on Turrbal and Yagara country. And we just wanted to start off today with an acknowledgement to country. We'd like to acknowledge the traditional custodians of the many lands on which we gather today as we live and work, and pay our deepest respect to elders past, present and emerging. I would also like to extend that same respect to the Aboriginal and Torres Strait Islander people who have joined us today, and acknowledge the continuation of cultural, spiritual and educational practices of Australian Indigenous peoples. So as we make our acknowledgement, we wanted to give you an opportunity to acknowledge the country that you're on today. So if you'd like to put an introduction into the chat, just tell us who you are and acknowledge your traditional country. We would love to have that as part of our webinar today. So you can continue with your introductions, and we're just going to get started. We are really excited this week to be officially launching a new developed Focus Topic 2 resource. And this is in acknowledgement of the National Close the Gap Day, which is on the 17th of March, on Thursday. So to start off our session today, we just have a short video presentation to introduce you to the toolkit.
Hello. The Palliative Care Education and Training Collaborative at the Queensland University of Technology delivers programs to support the health workforce care for people with palliative care needs. Given the history, trauma and current experience of racism in healthcare, it can be particularly difficult for Australian Indigenous peoples to talk about the kind of care and support they would like as they age or become seriously ill. So as a result, most communities are not receiving the best quality of care and support while they live with chronic illness and at the end of life. And this can have a profound effect on both the sick person and their loved one's experience of the end of life journey. Acknowledging this inequity is of particular significance in this week as we recognise National Close the Gap Day. So our collaborative aims to support the development of capabilities in the mainstream health workforce to provide holistic, safe and culturally responsive palliative care for Australian Indigenous peoples. I'm very pleased to be able to introduce you to this latest learning resource from the Palliative Care Curriculum for Undergraduates team. It's our Focus Topic 2 Toolkit, and we call it Caring for Australian Indigenous Peoples Affected by Life-Limiting Illness. It's our sincere hope that this resource will support the health workforce to improve the health of Australian Indigenous peoples through quality palliative care. Thank you.
In this short presentation, I'll be giving you a brief overview of the Focus Topic 2 resource. We'll look a little bit at how the resource was developed and some of the early feedback from educators and students. Development of this resource has been the work of many people over many months, and for those of us in the project team, it has been a time of great learning and some unlearning as well. What we have now is a toolkit of resources that's primarily targeted towards improving the cultural responsiveness of the non-Indigenous health workforce in providing palliative care. The toolkit can be used by educators in whole or in part, depending on the requirements of their curriculum and other priorities. Links are provided throughout the content to key palliative care concepts that are covered in various sections of the PCC4U core modules to ensure students' learning in this topic is connected to what they're doing in other areas. Our aim in developing this resource was to help build an understanding of the palliative care needs and barriers to accessing care experienced by many Australian Indigenous peoples. We also wanted to provide a learning experience that encourages students to engage in critical self-reflection around cultural safety and providing culturally responsive care. To support these aims, we have provided content, resources and thinking points across 6 sections. Let's have a look.
A prerequisite knowledge section with suggested review activities is provided to support the students' understanding of cultural safety as the framework in which to provide culturally responsive care. The first toolkit section has a focus on power, privilege, and the place of healthcare, encouraging students to reflect on how these aspects impact on barriers to palliative care. We then move on to provide some general information about Aboriginal and Torres Strait Islander cultures and how culture, kinship, and connections to country influence the views that many Australian Indigenous peoples have of health and well-being. Developing this aspect of the toolkit meant walking the fine line between promoting cultural safety rather than cultural awareness and the encouragement of Indigenous stakeholders to include content on cultures to help students develop an understanding of Australian Indigenous ways of knowing, being, and doing. We have reiterated numerous times throughout the content, as you can see here, that the information provided is generalised and that there is a high level of diversity among Australian Indigenous cultures, and that there is always the need for health professionals to ask rather than assume. The third section of the toolkit looks at the key features of the UN Declaration of Rights of Indigenous Peoples and how these relate to palliative care service provision. This aspect supports the inclusion of a rights-based framework, which is a key aspect of the curriculum in many current healthcare programs. We also provide a broad overview of historical events and outline how the past and ongoing trauma impact on the daily experiences of Australian Indigenous peoples and the barriers to palliative care that exist as a result. A focus on healing and resilience and the key enablers of palliative care service provision are explored in this section as well. The final two sections provide students with practical information and strategies for how they can provide family-centred palliative care and culturally responsive communication to the Australian Indigenous people that they care for who are affected by life-limiting illness. We've also provided key information on the key cultural considerations at the end of life. These two more practically based content areas refer students on to the many other learning resources that provide more detailed information, such as the IPEPA resources, the Gwandalan online modules, advanced care planning resources, and those available through the Australian Indigenous HealthInfoNet. For those of you who use our other core modules and focus topic resources, you will notice that there's more information provided up front with this resource in an About the Toolkit section. This information supports educators with implementing the toolkit in their programs and outlines some of the key considerations around promoting a safe and respectful learning experience. Specific information for educators around how the learning outcomes map to key strategies and frameworks is provided, which can be helpful when communicating the alignment of this content to curriculum and course accreditation requirements. Throughout the development of this resource, the PCC4U project team engaged at various points in time with key national stakeholders and advisory groups. The draft content went through a rigorous peer review process, which involved feedback from both Australian Indigenous and non-Indigenous academics and clinicians. The finalised content was made available to a group of student reviewers. Comments and feedback from students regarding their experience of learning have been very encouraging and have provided further insight into how we can best support educators to implement the toolkit content. A detailed description of the development process, including stakeholder engagement and peer and student reviews, is available on the website.
We hope that you take some time to look through the resources that are available in this toolkit and consider how you might begin to use this to support your students' learning in this area.
Well, as you heard in the introduction, our resource provides links out to many other education resources, and we're really privileged today to have representatives from 3 of those key project partners here to share with us. And they're going to talk a little bit about the education resources that they have available for us. Our first presenter today is Nicole Hewlett, who is the National Indigenous Manager for IPEPA and a huge supporter of ours in the development of the toolkit resource. We have been really grateful and honoured to have Nicole's wisdom and guidance and to be able to share the resources that IPEPA has available. And we're going to hear from Nicole now.
I am Nicole Hewlett and I'm a proud Palliative woman from Victoria, Tasmania. But I'm presenting to you today from where I work and play, which is Tribal and Yagara lands of Meanjin in Brisbane. I'd like to pay my deepest respects to elders, past, present, and emerging of this beautiful country, and extend this respect to all our Aboriginal and Torres Strait Islander people listening today. It's so beautiful to see you here. It's important to acknowledge that we are all on Indigenous lands, always was, always will be, and that our sovereignty was never ceded. I would also like to add that today we stand in the footsteps of millennia old. May we always acknowledge the traditional custodians whose cultures and customs have nurtured and continue to nurture this land since men and women awoke from the great dream. We honour the presence of these ancestors who reside in the imagination of this land and whose irrepressible spirituality flows through all of creation. So as Sharon said, I'm going to talk to you today a little bit about what is IPEPA, who are we? And at IPEPA, while we are funded by the Department of Health, our strength is that we are a program for community by community. We're governed by Aboriginal and Torres Strait Islander peoples, and the content that informs educating health professionals, whether that's our mob health professionals or non-Indigenous, is written by and facilitated by us to ensure that the program only has our voice, whether we're at a grassroots level or a strategic advocacy level. And all of this is because, at our IPEPA, our dream is that all Aboriginal and Torres Strait Islander peoples will have equitable access to palliative care, knowledge, resources and services, so that we can all pass with dignity, sovereignty and respect. And we're incredibly passionate about working with non-Indigenous people and stakeholders with the intrinsic knowledge that it really takes all of us working together in solidarity to achieve this dream and break down those systemic barriers for our people. So what are those barriers? There are 9 known barriers to our community accessing palliative care. And sitting behind these barriers is a story, a story that is often not told. It's a violent story of how the West invaded this country and broke our trust. And how current attitudes and treatment and environments keep that trust broken. But here is where each and every one of you listening today can make a difference for our people in rebuilding this trust and bringing healing to this country through transforming yourself and your ways of knowing, being and doing, so that our people can have access, equitable access to safe and culturally responsive healthcare. And that is what I feel this toolkit really embodies. And that is, whether you're starting or continuing your journey of culturally responsive care, what do you need to know, be and do in order to deliver culturally responsive care to Aboriginal and Torres Strait Islander peoples? Because just as, the trees, the plants, animals all provide the ingredients to make the ecosystem of life function, in a harmonious way, so too do each and every one of you as your own ingredients to create balance, harmony and healing. And only you can bring that ingredient. So how we achieve this is through offering placements where you can attend a specialist palliative care service and observe and learn on a 2 to 4 day experience. Here you can learn exactly what providing culturally responsive and holistic palliative care looks like in practice and in a really real world practice as well. We also offer reverse PEPAs, where we come to your service and support the cultural responsiveness across the entire organisation. And that can then be contextualised to your service in your area. And we also have culturally responsive workshops that embed Aboriginal and Torres Strait Islander ways of knowing, being and doing. And it's really underpinned by our learning approach, which is these 3 principles. So like many of our communities, water is a symbol of knowledge in the Yolngu philosophy. And the theory of Dharma, which you see in that bottom right-hand corner, it's where the 2 streams of knowledge combine and lead to deeper understanding and truth. Now, our Yolngu brothers and sisters have drawn on that metaphor for how Aboriginal knowledge, which is represented by the fresh water, and Western knowledge, which is represented by the water from the sea, they mix together to make and form the creation of new knowledge, this what they call this foam. And it's generated from the interaction and the collaboration of Aboriginal and Western knowledges. But in order for this new foam to form, there must be a balance where the two streams meet. Otherwise, one will be stronger and harm the other. So in this workshop, you bring your knowledge of your role and your service, and we bring our cultural and palliative care knowledge, and we work together to find out how we can find the Dharma, the new knowledge where our two worlds or our streams meet and can benefit from one another. Yarning is also underpinning these workshops, and this is a two-way and equal space where we come together and exchange information with, raw honesty and truth, so that we can find, the pathway where we can walk alongside each other. In this space, meaningful change and shift in your heart can occur because you need to be open to that and be deeply listening in order for that shift to occur, which brings us to our third component of IPEPA, which is the DD, a deep, still awareness and listening. We have so much, noise in our minds and attach to our thoughts in a million different ways, consciously or unconsciously, which of course, means there's no space for truly listening and connecting to your spirit or yourself, let alone having the capacity, to truly connect and listen to someone else's. And so the toolkit that we're launching today has, the spirit of IPEPA woven throughout it. And many, and I mean many of our community have fed into this. So you will feel the voice of our people as you take, the journey through this resource. And it's something that I'm really proud of the PCC4U team doing, because they've done that with such beautiful grace and integrity. But if you would like to continue your journey, after this resource, please visit, our IPEPA website, or sign up to a workshop, or connect to us on our Facebook page. You can also connect to the very deadly Gwandalan. They are all kinds of incredible, as you'll hear in a moment from Eliza. And then, of course, there is an immense amount of education resources on HealthInfoNet, which Darren will speak to. It's a one-stop shop for resources, reviews, reports, evidence, you name it. And you'll hear all about that shortly as well. But I also wanted to refer to this incredible shared decision-making tool, which has come out of the New South Wales Agency of Clinical Innovation. It's got beautiful resources around communicating positively with Aboriginal and Torres Strait Islander peoples, as well as some, practical advice on how you can engage our community and create culturally safe spaces. And it's got resources for you to do that. They've also developed the tool by mob for mob around how to create this two-way exchange in a way that our community can make decisions about their health in a very informed way. So I really encourage you to click on that link or Google the model, because it will rock your world and give you the tools to really hold the space in creating access for our people. But if you have any other questions, I won't be able to stay on for the entire webinar, but there is my email. I encourage you, please reach out. I'm not scary in any way, I hope. And I'm always happy to yarn about this stuff at any time. Thank you.
Wonderful. Thank you so much, Nick. It's lovely to have you presenting, and lovely to hear that, that endorsement of the toolkit resource. And as I said before, we really appreciate your input and guidance along the way in developing the resource. So we will farewell Nick here. If you need to, when you need to go, we'll say goodbye. But we'll be sharing the email addresses and contact information on our learning management system. So if you didn't quite catch that on the screen, and those links that Nick's shared as well. So great. So our second presentation today is from Eliza Munro, and she is the Indigenous Project Coordinator for Gwandalan Palliative Care Education, which is an AgPAL project. Eliza has also been involved in the development of the toolkit as a peer reviewer of content, and in providing some really insightful commentary to add to our original case study videos. We're huge fans of the Gwydelyn Education resources here, and really pleased to have Eliza today presenting for us. So just to start off with, Eliza has a short video that she'd like for us to watch.
Yaraba bingo yama. Nei nei wa you gali. Nei nei wa you gali. Nei nei wa you gali, nei na yua you gali. Yalana na yua you go yulambu. Yalana na yua you go yulambu. Yalana na yua you go yulambu. Yama and welcome. My name's Gavi Duncan. I am from the Darkinjung Local Aboriginal Land Council and we welcome you here. We pay our respects to our elders of past and present and also our youth of past and present. Gwandalan in local Darkinjung and Awabba language means resting place. It's important that health staff understand what palliative care is to Aboriginal and Torres Strait Islander families. It's important because culture plays a major role in that too. The spirit journey is very significant in our culture as Aboriginal and Torres Strait Islander people because it celebrates that story in regards to like the boomerang that Bayami holds in his hand in the rock engravings. It actually represents life going out and life coming back. So the life coming back is through the new birth as such, as children being born on the earth, as in leaving or coming from the spiritual world through their mother and father and then arriving through birth in the physical world. A good death is important. It really to the family itself, when they know that their loved one has had a good send-off, that their spirit rests easy. We believe in our culture that the spirit can be very restless if something is not right in regards to the send-off. Maybe the lost or the loved one had unfinished business on the earth as such, or is worried and sad for their family. So we try and heal that in a way that settles the spirit and the soul of our loved one so that you know, they can rest easy as such. We prepare the space as such. We prepare the community and we prepare our loved ones as such and make sure that they're comfortable and that they know that their family is there with them all the way. And that's something that we make sure that we you know, create a beautiful pathway for their next journey.
Thanks, Sharon. Thanks, Linda, for inviting me and Kylie in the PCC4U team. It's an honour to be able to come along today and share Gwydelyn project with everyone listening. So I just wanted to acknowledge, we'll start by acknowledging the traditional owners. The Gwandalan National Palliative Care just want to acknowledge the traditional custodians of the land on which we all live and work and recognise the continuing connection to land, waters and culture of all peoples across Australia. We pay our respects to elders past, present and emerging and acknowledge Aboriginal and Torres Strait Islander elders as the holders of knowledge, wisdom and law. We extend that our acknowledgement to any Aboriginal and Torres Strait Islander brothers and sisters that are joining us here today as well. Thanks, Linda. So as Uncle Garvey mentioned, the Gwandalan means rest, peace or resting place in Darkinjung and Awabba language. The Darkinjung and Awabba countries is what is now referred to as the Central Coast of New South Wales, and which is courtesy of New South Wales Health. You can see on the map where that Darkinjung country is. And as spirituality is an important aspect of Indigenous culture, we felt that the name would be appropriate in that if a patient has a good palliative and end-of-life care journey or a good death, it is hoped that their spirit can rest easy and also the spirit of the family still undertaking the journey of this lifetime. Thanks, Linda. So the Gwydelyn project itself. So the education and training materials for the Gwydelyn Palliative Care Project aim to support relationships between service providers, frontline staff and Aboriginal and Torres Strait Islander communities. We hope to achieve this through the support of cross-cultural education and the sharing of knowledge. We envision that this will be achieved through the provision and education of training to support increased capacity to those who care for Aboriginal and Torres Strait Islander peoples during their returning spirit journey. Gwydelyn Education does not address clinical palliative care content, but rather focuses on the cultural practices and communication strategies that assist health professionals to deliver safe and responsive palliative care services for our communities. The 5 key topic areas applied to across all Gwydelyn assets, including the e-learning modules, face-to-face workshops, and our webinars, including our toolkit and resources, include the following 5 topics, which are introduction to Aboriginal and Torres Strait Islander cultural, palliative care and cultural practice. Within that module, we look at some of the important cultural practices that are relevant to Aboriginal and Torres Strait Islander culture, which may include the dreaming and tagai. Sorry, business and sad news. What are those terms and what are their actual meanings? Kinship and family structures and the importance that family plays in end of life, not only end of life care, but everyday life of Aboriginal and Torres Strait Islander peoples. Our next topic is safe communication. Within that safe communication module, you'll find information on appropriate language and terminology in regards to commonly used terms for death and dying, and clinical yarning models, which are all around safe communication to help you have those conversations when you're servicing patients, when you're out in community. Supporting choices at the end of life. We felt supporting choice at the end of life education for Indigenous, not only Indigenous peoples, but for health clinicians would be beneficial when we're talking about advanced care yarning, organ and tissue donation and voluntary assisted dying. We find that given the cultural stereotypes around taboos around death and dying and organ donation, that a lot of our communities are missing out on the conversation actually had with them. So we thought that was an important topic to include in the training education. Strengthening relationships is a key part of the project overall deliverables, and the important thing about that is we want to strengthen a relationship between not only health professionals in general, but across us as human beings and people. So the idea with all the Gwydelyn content as well is that you can apply it wherever you go. So the strategies that we embed throughout the training is not only relevant to the palliative care space, but you can take that across. So which also brings the next topic in, which is community engagement. So once again, looking at the practical strategies, not only the cultural, but not only the educational content, but how to actually put those skills into practice and taking those skills wherever you go. So the reality of life is we never stay in the one place, and even with employment. So to have those skills and to be able to take them into any community that you may be working with. We focus on the core principles of Indigenous culture. Please bear in mind that as a national project, apply the learnings on a local level. Seek out cultural mentorship. So find somebody from the Indigenous community, whether it's your Aboriginal health workers when you actually get out in the field, and do that cultural brokerage and get that cultural mentorship. So to make sure that you're applying any learnings on a local level, given the diversity of our communities. Thanks, Linda. So the 3 training assets that may interest you guys as students, I'm assuming we've got mainly students on today, is the e-learning modules, which can be accessed via the Gwydelyn website and contain the 5 modules that I just mentioned. So currently the modules are also accredited for professional development points through the Royal Australian College of General Practitioners, the Australian Association of Practice Management, the Australian Primary Healthcare Nurses Association, and the National Aboriginal Association of Aboriginal and Torres Strait Islander Health Workers and Practitioners. Registration is free. Registration is required, but the modules are free to access. So the Gwandalan Dilly Bag may be of something of interest too. The Dilly Bag is a collection of resources that are relevant to Indigenous palliative and end-of-life care that health professionals can find in the one place. So we've gathered as many resources as we have been able to and put them all into one resource. That can also be accessed via the website. And the e-learning, the webinars, there's a series of webinars that will be delivered throughout this year. Some of the topics that will be included in those webinars include purely Torres Strait Islander palliative care, organ donation, voluntary assisted dying, and then other relevant topics from the Gwydelyn educational content. So the e-learning, the Gwydelyn website houses all the Gwydelyn resources. So you can jump on and have a look on that one and play around. I should have mentioned each learning resource has 3 modules. So each module has 3 sections. You can obtain your certificate at the end of each module. So you'll get one for each one. Jump on, have a sticky beak around. We've also got some downloadable resources on there at the moment. They're mainly promotional resources for Gwydelyn, but please feel free to share. And we've also got the Yarma newsletter, so jump on and have a look at that one as well. So thank you. I hope that the modules will be of interest. Keep an eye out for any of the flyers coming out for the actual webinars itself. We're hoping to host our first one next month, and we'll be sure to send through the information to Kylie and to Sharon to promote through this network. So thank you. I know it was very short and sweet, but I hope that gives a little bit of an overview of the Gwydelyn materials. And yeah, jump on and have a look at the website. Happy to be contacted at any time if anyone has any questions as well. I can answer them at another stage, but if anyone's got any other questions, contact details are there and happy to yarn at any time. Thanks, guys.
Thanks so much for that, Eliza. It's great to see those incredible amount of resources. And I have just added into the chat here on the webinar, just those links to IPEPA and to the Gwandalan resources. So we will be, of course, putting all of that information up on our website so you can have access to it after. Thanks, Eliza. So our third and final presentation today is from Darren Deeves, who's the Research Officer for the Australian Indigenous HealthInfoNet. There's an absolute wealth of resources available on this platform across a whole range of health topics. Darren's going to give us a quick overview today and then show us some of the specific resources that are available through the Palliative Care and End-of-Life Care portal. Thanks, Darren.
Okay, good afternoon, everyone. My name's Darren Deeves, and I'm a Senior Research Officer at the Australian Indigenous HealthInfoNet. Firstly, I'd just like to acknowledge and pay my deepest respects to the traditional owners of the land I'm presenting on today, the Wrapup people of the Noongar Nation, and also acknowledge the traditional owners of the lands from where everyone is connecting from today. I pay my respects to elders past, present and emerging, and also to any elders joining us on this webinar. So I'll just begin with a little background about the Australian Indigenous HealthInfoNet, or HealthInfoNet for short. So the HealthInfoNet was first established in 1997 with the aim to make research and knowledge around Aboriginal and Torres Strait Islander health easily accessible for anyone working or studying in this field. Our director is Professor Neil Drew, and we're based at the Edith Cowan University, Mount Lawley campus in Perth. The HealthInfoNet is an online web resource which aims to provide easy to access, relevant and high quality knowledge and information to support the Aboriginal and Torres Strait Islander health workforce in their practice and to assist policymakers in their decision making. We achieve our mission by undertaking research into various aspects of Aboriginal and Torres Strait Islander health and disseminate the results via various websites, including the HealthInfoNet, the Alcohol and Other Drugs Knowledge Centre, the Tackling Indigenous Smoking website, and Wellmob. The responsive design of the HealthInfoNet website and the Palliative Care and End-of-Life Care portal means that it can support the health workforce in any location with internet access or on any platform, be it a desktop, tablet, or mobile phone. So on to the Palliative Care and End-of-Life Care portal. The palliative care was originally an unfunded topic area, and we held only limited focus material. Recognising the topic's importance, the HealthInfoNet was funded by Palliative Care Australia in 2018 to develop the portal and create a quarterly newsletter for a national healthcare audience. New content is frequently sourced and added, and sections are audited throughout the year to ensure information remains relevant and up to date. To access the Palliative Care and End-of-Life Care portal, you start at the HealthInfoNet homepage, hover over the Learn tab at the top, and then click on Palliative Care and End-of-Life Care under the Health System drop-down menu. Then this is what the main page of the Palliative Care and End-of-Life Care portal looks like. The portal is designed to assist the health workforce who provide care for Aboriginal and Torres Strait Islander people, their families and communities. It also aims to support clinicians and policymakers in accessing relevant and culturally appropriate resources on palliative care and end-of-life care for Aboriginal and Torres Strait Islander people. The portal has 3 subtopics, which you can see in the grey column on the right-hand side of the page. These are culturally appropriate palliative care and end-of-life care, grief and bereavement, and planning ahead. So if we click into the culturally appropriate palliative care and end-of-life care subtopic, this will display all of the key resources in this area. And if we click the resources button, this will display all of the culturally appropriate resources for palliative care and end-of-life care. Resource types may be in the form of a report, video, booklet, fact sheet, brochure, posters, and more. I'm sure some of you will recognise these 3 resources that I've selected in the list. A quick guide to your first conversation about palliative care by IPEPA. The Journey to Dreaming Toolkit by the Aboriginal Health Medical Research Council of New South Wales. And the Aboriginal End-of-Life and Palliative Care Framework for WA by the WA Department of Health. If you scroll down on the Palliative Care portal homepage, you will see where the key resources and workforce information sections are located. The key resources are categorised into organisations, programs, publications, resources and policies. And then the workforce information includes funding opportunities, courses, events, and job vacancies. The portal is constantly growing and currently has over 450 online key resources and workforce information. You can see the total number of entries within each category and just click each one to view them. So for example, if we click into the resources section, it will display a list of all the palliative care and end-of-life care health resources like this. Then if there is one we want to look at, such as this Journey into Sorry Business booklet, we click on that and it will provide a short description of the resource and relevant links to access it below. Users can also filter their searches to save time and find exactly what they are looking for. Users can search by location, population, related health conditions, determinants or topics, or by document type. For example, if you were looking in the publications section for a New South Wales report, you can select the filter button, then customize your search to only show you entries which match these specifications. There are also other ways of refining search results. You can search by newly listed, recently published, or alphabetically, and you can use the advanced search filter button to search by keyword in the title. I'd also like to point out some other portals on the HealthInfoNet website which may be useful. Under the practice header, we have a section for health professionals, and this contains 2 portals. One for Aboriginal and Torres Strait Islander health workers and health practitioners, and the other on cultural safety for health professionals. Both of these contain helpful information for anyone working in the area of palliative care for Aboriginal and Torres Strait Islander people. Another important way we deliver knowledge exchange is through our yarning places, which includes our newsletters. The Palliative Care and End-of-Life Care portal distributes a quarterly newsletter, which allows our users to stay connected and up to date with the most recent content added to the portal. To sign up, you can find the Stay Connected section towards the bottom of the HealthInfoNet or Palliative Care and End-of-Life Care homepages, select newsletters, and then choose the palliative care and end-of-life care newsletter, as well as any others you may wish to also subscribe to. We also encourage people to contact us if they have something that they would like featured in one of our newsletters, such as a new program, research study, or any important achievements and news. And we also have a number of social media platforms where our users can stay connected with us. You can follow us on LinkedIn, Twitter, Facebook, Instagram, and YouTube. You can also contact us via the website if you want to suggest anything that you think could be added to the palliative care and end-of-life care portal. All of the links to these ways of staying connected can be found at the bottom of our website's pages. Thank you for listening, and here is my contact details if you wish to get in contact with me.
That's wonderful. Thanks so much, Darren, and thanks to Nicole, Eliza, and Darren for those great presentations. It's really lovely to see the absolute wealth of resources. I know I've spent many hours on the HealthInfoNet site looking for resources, and I've learned a few tips today about I could have maybe spent less time and found the same resources. So thanks for that, Darren. That's great. We just wanted to round out our webinar session today and take a few minutes to show you an example of one of the Toolkit activities and how you might be able to use that in your education. So I'm just going to share with you a Padlet board that we've created, and Linda's going to put that link in the chat if you'd like to open it up to look at for yourselves. So we've just used an activity 15, which is on symptom management, and added in a few elements from the activity into this Padlet board. So it's by no means the entire Padlet, it's by no means the entire activity, but we've just taken a section out to illustrate how you might be able to use the resource in your teaching practice. So the context contains medication use in palliative care, and the activity content describes what is a common concern for many Australian Indigenous people, pain management, particularly towards the end of life, and in particular the use of morphine. So we've provided some background information. We've got a link to what is the current version of our Tom Story case study video, which has the added expert commentary provided by Nicole and Eliza. So the students can watch the video and have a think about some of the reflection points that have been added by our expert commentary. We've also included a link to a practice tool that's from the Cancer Council on understanding morphine. And we've embedded two of the thinking points that are in the activity into this Padlet so that you could use it for students to, I guess, follow a pathway and share their responses and reflections as part of a group learning experience. We've provided some further information as well for students. As we've said, the toolkit links back to the core modules for PCC4U when it comes to those kind of core concepts like symptom assessment and management. So we've linked back to core module 3 and then provided a link to the entire activity 15 content so that students can see the other resources and the other information that's in there. So it's not just medication based. I think this just illustrates in a short way, I guess, how we've approached the development of the toolkit in terms of providing content that's relevant with our videos embedded throughout of telling the stories of people experiencing life-limiting illness, and showing you that we link out to other resources where they've been developed so that we're not, I guess, reinventing the wheel, and helping students to understand all of the multitude of resources that are available. The thinking points there illustrate, I guess, the active approach that we've taken in the toolkit in trying to get students to to think about and reflect on how they might respond in that situation, and to prepare ahead of time of how they would approach a conversation, and how they might, what resources they might use, and even to the point of, you know, thinking about what words would they say, how would they broach conversations. So I guess that's just it in a nutshell. And we actually do have some time for questions if people want to put some questions to. I know that Nicole's gone, but Eliza's here and Darren's still here. If you have questions about resources, then we certainly can ask that. If you have questions about the Toolkit resource, we're really happy to answer that. For those of you who are still looking at that Padlet resource, you know, and you want to comment on how you might use that, or whether you think that would be a helpful resource, we can hear from you as well.
Aaron, I really like the layout of the Padlet that you just, sorry, it's Lise Martin from TAFE Queensland. I really like that layout that you just showed us of the Padlet. It's really interactive and I think really engaging for students.
Oh, great. Thank you. We do see that educators use PCC4U resources in a whole range of ways that maybe we hadn't actually thought about or expected. So certainly, you know, taking out content that's in the toolkit and presenting it to your students in a way that best fits what they're learning at the time and how you want them to approach it is certainly, you know, something that people do all the time, and we're really happy for people to use those resources in that way and link back into the toolkit. Yeah, just including it. So thank you for your feedback. That's really helpful. We also know that people will use this kind of content in presenting to students, not necessarily about palliative care, but say if you're talking about medication or you're talking about you know, cultural responsiveness, you can you know, include something like that. It doesn't have to be a palliative care specific subject that you're teaching.
Trudy and I teach the Diploma of Nursing, enrolled nurses, and certainly that would be very true for a broad section of across many units that we teach. Trudy and I are palliative care teachers in the course, but teach other units as well, and I can definitely see us utilising to link to other units as well. So thank you. It's a great layout.
Great, you're welcome. And Kylie's just added the link to the focus topic 2 resource in the chat there, so you can go on and have a look at the resource. Yeah. Any questions for Darren or Eliza? Are they off the hook today? They presented so well and so thoroughly that we have no questions for them.
Sorry, I feel like I'm hogging it, but I will say thank you, Darren. I use your resources all the time, but Eliza, yours are new to me, but I certainly will be using them in the future. So thank you.
Oh, great.
Thank you.
They're really good, those the Gwandalan modules.
And can I just butt in there? There was a question on the chat asking Eliza just to point us in the right direction for the dilly bag resources.
And if everyone can bear with us for another 2 weeks and then jump on and look at the dilly bag, it'll be there for you to access.
Great, thank you.
Thanks, Eliza. You're still packing the dilly bag. There's so much to get in there, I'm guessing.
We need a lot of tools for this journey, so yeah.
Yeah, that's right. Great. Well, Kylie, I'll just hand over to you then.
Thanks very much, Sharon. It's my absolute pleasure to be able to wrap up this session. I think we've just got a slide around the sort of conclusions and sort of take-home messages. I think first and foremost, acknowledging that this resource and the toolkit that has been a collaborative effort for the development, really primarily led by Sharon, and I think publicly acknowledging the amazing work that she has done in pulling this together, and also the partnership with Nicole from IPEPA, I think has been very successful, and the resource bears that out and shows how the outcomes have been fantastic. So we will be formally launching the resource on Thursday. And I think it really, as you know, Nicole had alluded to, the fundamental Indigenous ways of knowing, being, doing have been very much threaded through this resource. And a lot of the educators have commented on that, in that it is a beautiful way of framing the resource. We, of course, like all of the PCC4U resources, they're available at no cost. And Sharon has given us a couple of examples today about how it can be delivered in a very flexible way. So you can direct students to just complete the resources in a self-directed way or combine it for blended learning. And it's for all of the nursing, medical and allied health programs, entry to practice programs. And I think that there really shows that on a whole, a lot of these projects have developed resources that are really able to now support the whole of the workforce. So PCC4U, we're really focusing on resources that are going to support that entry to practice, beginning practitioner education. And then we have amazing resources with IPEPA, Gwandalan and the Australian Indigenous HealthInfoNet to support clinicians in their ongoing learning journeys. So thank you very much again, Eliza, Darren and Nicole, for presenting today and sharing your resources. And we're really proud to be able to share our focus topic too with everyone here today. So thank you very much. We will just pop up a poll up now just to get some feedback from you around this webinar. And while you're doing that, I'll just remind you that this is part of a series of webinars that we have every month. And our next webinar on the 19th of April will be focusing on our Enrolled Nurse Toolkit. So focusing more so for the registered training organisation teachers in the audience, but yeah, really important resource as well. So thank you very much, everyone, for your time. And you're able to access the recording of this session. So we'll have that edited in the next few days, and that will be available on our YouTube channel in the group of resources for the webinar, and you'll be able to see the recordings there. And the links are also within our Palliative Care Education learning management system as well. You can find all of the information there and some of our presentations as well.
Thanks, Kylie. I was also just thinking we'll include the Padlet link in those resources on our learning management system. So if you do already have a Padlet account, you can take that one and use it for yourself, whatever you'd like to do with it. And then, yeah, obviously, as we said, if you've got ideas for resources and how they can be used and ways we can better support educators to use these resources, we'd love to hear from you.
Very good. All right. Well, thank you very much, everyone, for joining us today. More than happy to answer any questions, but follow up with any emails or comments down the track as well. Thank you. Have a great day.